Dear everyone, our body is a miraculous machine that constantly tries to signal when something is wrong. However, many people unintentionally ignore these seemingly small signs, especially in the feet, nails, or abdominal area. For middle-aged and elderly individuals, these body parts can reveal early warnings of dangerous diseases such as diabetes, heart disease, or even cancer. In this video, we will explore 5 abnormal signs in the feet, 5 nail changes to watch out for, and 5 dangerous symptoms in the abdominal area that should not be overlooked. This information can help you proactively detect health issues early, thereby protecting yourself and your family in the best way possible. Listen to your body, because health is not only the most valuable asset but also the key to a long and happy life. Part 1: Signs in the foot warning dangerous diseases. 1. Persistent swelling in the foot. Swelling in the foot and heart failure often go hand in hand. When the heart cannot pump blood effectively, blood accumulates in the blood vessels, especially in the lower limbs, leading to swelling. This phenomenon does not only appear in the foot but can spread up the leg, sometimes even to the calf. This is a typical symptom of right heart failure, where the right side of the heart, responsible for pumping blood back from the body, functions inefficiently. Additionally, kidney failure can also cause swelling in the foot. When this organ is damaged, the body cannot eliminate excess water and salt, leading to fluid retention in the soft tissues of the legs. Swelling due to kidney failure often comes with other symptoms such as fatigue, decreased urination, or even changes in urine color. Liver disease, especially cirrhosis, can also cause swelling in the foot. When the liver weakens, the level of albumin protein in the blood decreases, reducing the body's ability to maintain fluid balance. This makes it easier for fluid to leak out of blood vessels, accumulate in the foot, and cause swelling. 2. Pale and cold skin on the foot. When the skin of the foot becomes pale and cold, this is not something to ignore. It may be a sign of peripheral artery disease, a dangerous condition that affects blood circulation to the legs. Imagine the body's arteries as highways transporting oxygen-rich blood from the heart to every part of the body. When these pathways become blocked due to atherosclerosis, the buildup of cholesterol and fatty substances, blood cannot flow smoothly to the lower limbs. As a result, your feet will become pale and cold due to a lack of oxygen-rich blood. However, the issue goes beyond just changes in color and temperature. Peripheral artery disease also brings clearer warnings. You may feel sharp pain or heaviness in your legs when walking. This happens because the leg muscles lack oxygen during activity. The pain subsides when resting, but the condition will worsen if left untreated. More alarmingly, if not detected early, peripheral artery disease can lead to serious complications such as non-healing ulcers, tissue necrosis, and, in severe cases, limb amputation. Additionally, this disease signals a high risk of cardiovascular problems. 3. Slow-healing foot ulcers. If a foot ulcer persists without healing, diabetes is often the primary cause to consider. High and uncontrolled blood sugar levels damage small blood vessels, preventing blood from nourishing the affected skin area. Additionally, the immune system of people with diabetes functions poorly, making it harder for the body to fight infections and heal wounds. Diabetic foot ulcers usually appear on the sole of the foot or near the toes, where mechanical pressure and friction are highest. Besides diabetes, peripheral artery disease is another common cause. When blood flow to the foot is restricted due to atherosclerosis, the affected area does not receive enough oxygen and nutrients to heal, prolonging the ulcer. This condition may also come with sharp pain, numbness, pale and cold skin. In some cases, a slow-healing ulcer may indicate more severe conditions, such as skin cancer in the form of a non-healing wound. In rare cases, it may also signal bone infection when bacteria penetrate deeply from the ulcer into the underlying bone. 4. Nighttime leg pain. A peculiar aspect of this pain is that it often worsens at night when lying down, as blood flow to the legs further decreases. Some people find relief when sitting up or dangling their legs off the bed, as this posture improves blood circulation. However, this is only a temporary solution. The body is signaling that your blood vessels need immediate attention. However, blood vessels are not the only concern. Nighttime leg pain can also result from peripheral neuropathy, a common condition in people with diabetes. High blood sugar levels damage nerves, particularly in the legs, causing burning pain, tingling, or numbness. These symptoms intensify at night, disrupting sleep and affecting overall health. Additionally, some individuals may have restless leg syndrome, a neurological disorder that causes an uncontrollable urge to move the legs when lying down. While this syndrome does not cause physical damage, the constant need to shift positions to relieve discomfort can severely disrupt sleep. 5. Persistent foot odor despite cleanliness. The most common cause of this condition is a fungal infection, often referred to as athlete's foot. Fungi thrive in warm and moist environments, such as tight, non-breathable shoes or socks. When infected, the skin between the toes typically becomes flaky, itchy, and red. The breakdown of these skin cells produces an unpleasant odor, even after washing the feet. Besides fungi, bacteria are another notable culprit. Some types of bacteria on the skin can break down sweat and oils, releasing sulfur compounds that create a strong odor. This usually occurs in people with overactive sweat glands or those who frequently wear socks and shoes. However, if foot odor persists despite maintaining good hygiene and keeping the feet dry, it could be a sign of an immune system issue or diabetes. In people with diabetes, persistent foot odor may be linked to chronic infections from wounds that fail to heal. High blood sugar levels create a favorable environment for bacteria to thrive while simultaneously weakening the immune system, making it harder for the body to fight infections. If foot odor is accompanied by cracks, ulcers, or swelling, it is a serious warning that requires immediate medical attention. Part 2. 5 Signs in Nails Warning of Dangerous Diseases. 1. Pale white nails. Imagine the blood in your body as a river flowing to nourish every cell. When the body lacks blood, this river gradually dries up, causing the nails, normally supplied with oxygen from the blood, to become pale. Iron deficiency anemia is the most common cause. Without enough iron, the body cannot produce hemoglobin to transport oxygen, resulting in the nails losing their healthy pink color and becoming a mirror reflecting the body's oxygen deficiency. However, the story does not end there. If the nails turn completely pale white, the main culprit could be the liver. This remarkable organ, responsible for detoxification and maintaining protein balance in the blood, will send warning signals when it has problems. In diseases such as cirrhosis or chronic hepatitis, the liver cannot produce enough albumin, an important protein that helps maintain the natural color of the nails. As a result, the nails become pale white, sometimes accompanied by severe symptoms such as jaundice or swelling. 2. Black streaks on the nails. Melanocytes, the cells responsible for producing skin pigment, sometimes become abnormal and grow uncontrollably. When this happens under the nails, they create black or brown streaks running along the length of the nail. This is not a normal phenomenon and differs from color changes caused by injury. These dark streaks do not fade over time and tend to spread or darken, one of the characteristic signs of malignant melanoma. However, because this sign is painless and appears harmless, many people ignore it. In reality, melanoma is one of the most dangerous types of skin cancer because it is often diagnosed late. If detected early, treatment can be simple and effective. But if left untreated, cancer cells can spread to other organs, posing a life-threatening risk. It is important to note that not all dark streaks on nails indicate cancer. Some cases arise from minor injuries, medication use, or natural hyperpigmentation. However, if the streaks do not disappear, spread, or cause nail deformity, consider it a medical emergency. 3. Spoon-shaped nails. This condition occurs when the center of the nail sinks inward while the edges curve upward, forming a shape like a spoon. Spoon nails become thinner, more fragile, and can detach from the nail bed. While it most commonly affects fingernails, it can also appear on toenails. The most common cause of spoon nails is anemia or iron deficiency when the body does not produce enough red blood cells. Other causes include nail trauma, chemotherapy, radiation therapy, or frequent exposure to solvents and detergents. Chronic conditions such as diabetes, malnutrition, protein deficiency, thyroid disorders, or Raynaud's syndrome can also lead to spoon-shaped nails. In some cases, genetic factors or environmental influences play a role. If spoon nails are due to iron deficiency, patients should supplement with iron-rich foods such as red meat, seafood, and legumes, combined with vitamin C to enhance absorption. For cases caused by vitamin B12 deficiency, doctors may prescribe supplements. Besides treatment, daily nail care is crucial. Keeping nails clean and dry, trimming them neatly, using moisturizer after bathing, and wearing gloves when handling chemicals can help protect and improve nail health. 4. Brittle and easily broken nails. One common cause of brittle nails is thyroid disorders, especially hypothyroidism. The thyroid gland regulates metabolism, including the production of essential proteins for healthy nail growth. When thyroid function declines, nails do not receive enough nutrients and moisture, leading to dryness, brittleness, and easy breakage. This symptom often accompanies other signs such as dry skin, hair loss, fatigue, and unexplained weight gain. Nutritional deficiencies, including a lack of biotin, zinc, or vitamin A, also contribute to brittle nails. Biotin, also known as vitamin H, plays a crucial role in maintaining strong nail structure. Without enough biotin, nails become weaker and less resistant to environmental factors such as water and chemicals. Aging can also lead to brittle nails as the nail's natural protective layer deteriorates, making them less resilient. However, if this condition occurs early or persists for a long time, especially with other unusual symptoms, it may signal an underlying health issue. Treatment should not focus only on external nail care, such as using nail oils or reducing chemical exposure, but also on nutrition and medical checkups. Consuming foods rich in biotin and omega-3 fatty acids, along with seeking medical attention if the condition persists, is essential. 5. Red streaks under the nails. These red streaks under the nails are actually splinter hemorrhages, occurring when tiny blood vessels break due to bacterial endocarditis. This condition leads to bleeding, forming red or brown streaks under the nail plate. These marks do not disappear on their own and are often accompanied by other symptoms of endocarditis, such as prolonged fever, fatigue, muscle pain, and, in some cases, difficulty breathing. The formation of these red streaks stems from bacteria entering the bloodstream, creating small blood clots that travel throughout the body, damaging tiny blood vessels, especially in the fingertips where blood circulation is dense. Although this sign does not always indicate endocarditis, if it appears alongside severe symptoms, it should not be ignored. Endocarditis is a serious condition that can cause permanent heart damage and life-threatening complications if not diagnosed and treated in time. This is a chronic digestive disorder that makes you feel dull or sharp pain in the abdomen, accompanied by symptoms of diarrhea or constipation. The disease is often related to nervous stress or diet, but if not controlled, it can significantly reduce the quality of life. However, if the pain is concentrated in a specific location, such as the area above the navel, it could be a sign of a stomach or duodenal ulcer. These ulcers form when gastric acid attacks the stomach lining, leading to a burning or prolonged discomfort, especially when the stomach is empty or immediately after eating. Persistent abdominal pain may also be related to chronic pancreatitis, a condition that occurs when the pancreas remains inflamed for a long time, often due to alcohol abuse or gallstones. The pain caused by this condition is usually concentrated in the upper abdomen and may radiate to the back, accompanied by symptoms such as nausea or unexplained weight loss. More dangerously, persistent abdominal pain can be an early sign of cancers such as colorectal cancer, liver cancer, or pancreatic cancer. Tumors in the early stages often do not cause significant pain, but as they grow and press on surrounding organs, the pain will persist and become increasingly severe. 2. The appearance of lumps in the abdomen. The most common cause is a hernia, a condition that occurs when a part of soft tissue, such as the intestines, is pushed through a weak spot in the abdominal wall, forming a protruding lump. Hernias often become more visible when you stand, cough, or lift heavy objects and may disappear when lying down. Although hernias are initially painless, if left untreated, they can lead to dangerous complications such as strangulated hernia, causing the trapped intestinal tissue to become stuck, leading to severe pain or intestinal obstruction. Besides hernias, lumps in the abdomen can also indicate tumors, both benign and malignant. This is a sign that should not be ignored, as tumors can develop silently before causing more severe symptoms. Lumps in the abdomen may also result from an abdominal aortic aneurysm, a dangerous condition in which the artery wall weakens and expands, posing a risk of rupture at any moment if not detected and treated in time. 3. Purple stretch marks on the skin. Unusual stretch marks may stem from hormonal imbalances, particularly in Cushing's syndrome when the cortisol hormone levels in the body are abnormally high. Cortisol is an important hormone, but when in excess, it breaks down collagen and elastin, two key factors in maintaining skin elasticity and health. As a result, the skin becomes thinner, more prone to damage, and develops deep purple stretch marks, often on the abdomen, thighs, or arms. This syndrome not only affects the skin surface but also comes with symptoms like uncontrollable weight gain, muscle weakness, and easy bruising. Besides endocrine disorders, chronic liver diseases, especially cirrhosis, can also leave marks on the skin. When the liver loses its ability to metabolize proteins, the skin's structural integrity weakens, making stretch marks more visible. At the same time, the accumulation of toxins in the body due to impaired liver function can change skin pigmentation, causing it to appear not only stretched but also dark purple or discolored. Additionally, thyroid disorders such as hypothyroidism should also be considered. The thyroid gland plays a crucial role in regulating skin regeneration and connective tissue production. When its function declines, the skin loses its natural elasticity, leading to abnormal stretch marks even without significant external impacts. More dangerously, in some cases, purple stretch marks on the abdomen may be an early sign of the presence of tumors inside the abdomen. This is particularly concerning if accompanied by symptoms such as abdominal pain, bloating, or unexplained weight loss. As tumors grow, they can press on the abdominal skin, causing purple stretch marks to appear without any significant weight changes. 4. Abdominal pain accompanied by unexplained weight loss. This is not just simple discomfort. When you lose weight without changing your diet or physical activity levels, your body may be using energy to fight an underlying health issue. These battles may occur in the digestive system, where organs such as the stomach and intestines struggle not only to process food but also suffer significant damage. Conditions such as stomach ulcers, Crohn's disease, or even gastrointestinal cancer can prevent nutrients from being absorbed or cause energy to be wasted on feeding malignant tumors. However, the issue is not limited to the digestive system. Abdominal pain accompanied by weight loss can result from hormonal imbalances. Think of hyperthyroidism as an engine running out of control, burning energy at an excessive rate. When the thyroid gland becomes overactive, the body consumes more energy than it receives, leading to rapid weight loss and abdominal pain due to digestive disorders or nervous tension. Sometimes, the cause is not immediately visible. Conditions such as peritoneal tuberculosis, chronic pancreatitis, or even vasculitis can cause unpredictable pain. Their destructive effects manifest in the body's gradual weakening without any prior warning. These conditions not only affect digestion but can also leave you feeling exhausted over time. Dear readers, the unusual changes in fingernails, feet, or abdomen that we have discussed are not random occurrences. They may be early warning signs of dangerous diseases, from hormonal disorders and infections to cardiovascular issues or even cancer. Health is the most valuable asset, and being proactive in paying attention to even the smallest symptoms can save your life. Do not hesitate if you notice any abnormal changes in your body, seek medical attention immediately. Early detection and treatment not only protect your health but also prevent unpredictable complications. Spread this message to your loved ones. Share this information so that everyone can raise awareness about their health and take timely action when their bodies signal a problem. A little care today can make a big difference in the future. So, love your body and listen to it every day. Thank you for listening. Goodbye and see you again.